Today we're going to be looking at a teeny tiny muscle of the jaw that can cause all sorts of problems, and it is called the medial pterygoid. So we're going to be looking at how to locate one of the attachment points for this muscle and treat it yourself. And we're going to be looking at all of the problems that this muscle can cause. So my name is Ellie Lindsay. I'm a TMJ myofascial specialist, and I'm really enjoying bringing this self-care online to you so that you can incorporate the techniques that I use with my clients at home yourself. And I hope that feels really empowering for you to actually have those tools at your fingertips. So the medial pterygoids, let's have a look at what it looks like. So you can see here that this is where the muscle actually sits in the jaw. It comes down like this and attaches to that kind of angle of the jaw at the bottom there. And you can see in this picture that trigger points in this muscle can refer quite intensely to this area here, just in front of the ear, or also down here, kind of like just below the ear there, and also these red spots so inside the mouth here, which indicate sort of having pain in the teeth or inside of the mouth as well. So that's the usual pattern of pain that this muscle can cause, but it's not always exact. You can get other sorts of pain as well from this muscle, just in the generalized area of where it is. And so if we have a look at our actual, what a jaw looks like from the outside, what a face looks like, and just try and kind of locate that muscle on a real body, which is me. So it's actually just comes down here. So it comes from the jaw sort of area up here, and then it comes down in a line and it attaches to this bone here, the mandible. So it's not very big, you know, it's quite a small muscle, even though it can cause all of these sorts of problems. So that's where it sits, and then we're just going to look at how you can access that. So the easiest way to access this is actually under the jaw itself, where it attaches to the mandible. So what we're going to do first is, so this is a bit of self-care, this will just take you a couple of minutes, is we're going to just warm that area up. So I'd like you to just take this pincer grip with your thumb and your finger here, and just go find this kind of angle of, this is called the angle of the jaw, and you can see why, because there's kind of like a sharp corner here. If you just come under your ear, and then you'll feel there's a sharp corner. So if you just find that, that's where we're going to start, and our thumbs are going to be underneath and our fingers are going to be on top. And then we're going to sort of sink in a little bit, not really pushing in, but just sinking in a little bit. And then we're going to bring the thumb and the finger forwards. So it's like this. I'm going all the way forward to our chin. And then we're going to go all the way back again. And really here, we're working on this fascia of that area. And we're also giving the body just a bit of warning that we're going to go in a little bit deeper in a minute. So we're just going to do that a couple of times, 2 or 3 times would be great. Just take it slow. Okay, and then we're going to be looking for the attachment area itself. So we're going to take off just our thumbs this time, and you have the option of treating one side at a time or both sides together. So what we're going to do is find that angle again, and this time we're just using our thumb to go up, and our thumb that side if you want to go up, and then we're going to push forward onto the bone. So the idea is that we go up sort of behind the bone, and then we push forward onto it with our thumbs. So up and then forward. Now this might feel really painful, so if it does, then just ease off and apply a lot less pressure. You don't need too much pressure here. If you're doing both sides at once, you may notice that one side feels very different to the other. And then when we've been there sort of, 15-20 seconds or so, we're just going to come off, and then we're going to move forward just a tiny bit and do the same thing. So we're going to be there for about 20 seconds or so. And then as I'm talking, you can move back. So there's only those two spots that we're interested in because that's where the medial pterygoid is. So as I'm talking, you can just go back in and just repeat that 2 or 3 times. And just remember to keep the pain levels low. We don't want this to be really painful. And what's sort of key to look for here is if the area itself is tender, and that's why treating both sides at once is a good idea, because you get an idea of perhaps what it should normally feel like, which may feel like you may feel like that on one side, and what a sort of side that might have trigger points in feels like. So you might get an idea of the two differences there. And the other thing to look for is any referred pain that you get elsewhere. So if you remember in the picture, that diagram of the kind of pain radiating out from there into the teeth, into the ear there as well. So while you're doing this trigger point work, just have a little notice of whether you're getting any of those symptoms at the same time, because if you are, then it's likely that the medial pterygoid is involved with that. Okay, so that's your self-care for the medial pterygoid. So if you do that a couple of times a day, that would be great. Just kind of coming forwards and back, warming the area up and working on the fascia. And then we went in and did some trigger point therapy, which was compression of the muscle attachment points. So do let me know how you get on, or if you have any questions about that. If you haven't got my free guide already, then I have a free guide which is 5 top tips for headache and jaw pain prevention, and you can grab that at thewellnessformula.co.uk/guide.